Hello, I'm paramedic student Weary. Today's video is secondary assessment. Okay, we're going to start off with the scene size up. BSI, I have my gloves on, my safety glasses on. My scene is safe from hazards, weapons, electrical, thermal, chemical. I'm going to check my environment. Is it daytime or nighttime? Hostiles, bystanders, the temperature, and do I have adequate space to work on my patients? The mechanism of injury or illness is next. The number of patients, additional resources if needed, and consider spinal immobilization. Then I'm going to form a general impression of my patient using the FEDSO and WARF. And determine the patient's level of consciousness, determine the chief complaint, apparent life threats, fixing anything as they need them as they come. Then we're going to assess the airway and breathing. Airway, is it too slow, fast, or noisy? Open and secure if needed. Is the chest equal rise fall? Assure adequate ventilations. If I'm going to initiate oxygen therapy if needed. Secure an airway if needed. Circulation is next. I'm going to place my forearm on the patient's forehead. Check for temperature, skin color, texture, and turgor. And check the patient's pulses, meter century, at the wrist. And then we're going to move on to the eyes. Next is the eyes. Or they respond. Then we're going to expose the chest, check for JVD, lung sounds, PMS, at the wrist, at the feet. And then we're going to make our plan if the patient is it a priority, move, load and go, or stay and play. And then we're going to move into our secondary assessment. We're going to use the acronym OPQRST. Onset, provocation, describe the quality of pain, radiate anywhere, pain scale, does the pain change or is it consistent? Have they taken any treatments? And then we're going to move to the past medical history, signs and symptoms, meds, allergies to meds, food or other, medications they're on, home remedies as directed as last doses, past pertinent history. Has anything ever happened like this before? Last oral intake, events leading up to this. What brought this on? And habits, is there drugs, etc., tobacco, environment, and risk factors. And then the secondary assessment, brain, lungs, heart, check these from the top. We're going to do the brain, the HENT, HEENT. Check the neck for JVD, C-spine, tracheal midline deviation. Primary chest and lung sounds front and back. Cardiovascular heart, PMS, hands and feet, cap refill, ankles, pedal edema, and skin. Make sure pink warm dry, diaphoresis, so on and so forth. Then and then I'm gonna get a set of vitals. We're gonna get temp, pulse, respirations, BP, O2 saturation, glucose, CO2, EKG, skin, LOC, and check the eyes again. Then we're going to load and go and get to the hospital of choice. Thank you. Bye.